Since 2017, health workers have had several episodes of industrial action, but little has been done to meet their demands. Professor Freddy Sengoba, a public health policy and management expert, says the cost of government's failures on its promises is felt by the public.
The communities actually don't get the services that they need from the system. And that is usually a way to bring about distrust in what government structures are trying to offer.
On the other hand, Professor Francis Omaswa says Ugandan health workers are leaving the country because of the poor working conditions.
Like radiographers, many are going away. Like radiologists, many are going away. Like even anesthesia people. Because the crisis in Uganda now is that there are many vacancies in the public service. If you go to regional referral hospitals, if you go to health centers, if you go to health center 4s, you go to district hospitals, there are vacancies. At the same time, there are so many unemployed doctors.
The experts believe the shortages created violate the right to health and put Ugandans' lives in jeopardy by depleting the country of much-needed medical personnel.
Health is essential for productivity of people. If we don't have a healthy society, we are not going to have a productive society. We lose these people's services, and somehow it feeds into the economic development of the country. When people spend too much time attending to sick people, spending money which the family should be using maybe for sending children to school or buying better food, into health care.
Government has repeatedly argued that it does not have the funds to meet all the health workers' demands.
The governments have learned to hide behind the charity that comes in for health, particularly. So we get a lot of donor aid, especially to support programs like HIV, TB, malaria, and reproductive health. So governments then learn to slowly withdraw their contributions or to grow their contributions.
However, both Professors Sengoba and Omaswa have suggestions on how health financing should be handled for better outcomes.
The countries which have done best with their health systems are those which fund health systems through the tax base.
How do we plan for these salary increases alongside the functionality you need? You know, it will be painful to have people well paid and the communities see that they don't have anything to do and they just refer. You know, we can't help you because the medicines are not here.
Some commentators say there is no political will to finance health in Uganda, and this argument is based on the fact that Parliament has on several occasions passed supplementary budgets in favor of fulfilling politicians' demands, but not those of health workers. Walter Mwesigye, NTV.